I'm Amanda Matthews, owner of Integrity Insurance. Most people remember seeing FICA or Medicare tax pulled out of their checks when they were working. If you worked at least 40 quarters, you're entitled to Part A of Medicare at no additional cost, which is what this FICA tax paid for. Part B of Medicare is a little different. In most cases, you have to pay $164 a month for Part B. If someone has very low income or higher income, they may pay less or more. Once you have A and B of Medicare on your red, white, and blue Medicare card, that's called Original Medicare. Technically, that's insurance. The problem is it's not great insurance for a few reasons. It has high deductibles in the hospital. For example, if you're hospitalized, you would pay $1,600 on day one. And you would end up paying 20% of everyday medical visits and procedures like primary care, MRIs, emergency room, outpatient surgery, and more. The biggest problem, though, is that it doesn't have a cap or a maximum out of pocket, which means that if you had a serious problem, like cancer, and needed chemo or radiation, you would end up paying 20% with no upper limit. That comes out to tens of thousands of dollars. Another problem with Original Medicare is that it doesn't have Part D included. Part D is what helps you pay for your prescription drug coverage. For these reasons, almost everyone with Medicare goes one of two routes to get additional medical and prescription coverage, as well as extra benefits. The first option is a Medicare Advantage plan. Generally, these are including Part D prescription drug coverage. The second option is a Medicare supplement paired with a prescription drug plan. There are instances like veterans who get their prescription coverage through the VA who may not need the extra drug coverage. Both of these options are great. Anyone who tells you otherwise is trying to sell you something. The goal of both is to cover the high out-of-pocket costs that having only Original Medicare will expose you to. Oh, and by the way, no one is allowed to call you regarding Medicare Advantage and prescription drug coverage unless you've given them explicit permission, like filling out a form online. There are so many scams going around right now that I caution you not to speak to someone on the phone unless they can tell you exactly how they got your contact information. Medicare Advantage is also known as Part C of Medicare. The most common subtypes of Medicare Advantage are HMO and PPO. Generally, you see little or no monthly premium on these plans. They do use networks at doctors and hospitals, and they have copays, very similar to a group plan. The benefit is that they have very manageable copays, the Part D prescription drug coverage is included, and a lot of times you get added benefits like gym memberships, healthy food allowances, transportation, over-the-counter credits, eyeglasses, and dental coverage. In many areas, there are also special Medicare Advantage plans created for people who have Medicare and Medicaid or Medicare alongside chronic health conditions like heart conditions or diabetes. Medicare supplements are also a great option. Sometimes these are referred to as Medigap policy. The subtypes of Medicare supplements are called plans, and they range from Plan A through Plan N. The most common plans currently are Plan G, which recently replaced Plan F as the top of the line option, and Plan N. Supplements have a higher monthly premium. When you're new to Medicare, you could expect a Plan G to be around $120 to $160 a month. They do not include the Part D drug coverage, so you have to add that separately. Prices and coverage vary, so you want to have an agent run your prescriptions before choosing a plan. The nice thing about Plan G is that it doesn't have a network, and there are no copays. Most of the time I see people enroll in supplements who really crave the convenience of not having to use a network and the peace of mind of knowing that they'll never have to pay anything outside of their premium and the Part B deductible, which is currently $226. I want to reiterate what I said previously, which is that both of these options are really great. It just depends on how you prefer to use your healthcare as to which one's going to be a better fit for you. It's really important to work with a local agent who will ask key questions and help you narrow down what's best for you. The 800 numbers don't have a good grasp on local plans and local networks, nor do they follow up with you. We've had several clients prior to coming to us who have been put in plans that cost them thousands of dollars more per year. Our agents are verified and our agency is listed on Google with a 5-star review. We would love to advise you, always with no obligation and no pressure. Our phone number is 720-990-1680. Have a wonderful day.